Unexpected or traumatic clinical events, medical errors, and patient-related injuries happen. And when they do, they can lead to an emotional aftershock for healthcare providers. If you are having feelings of being personally responsible for an unexpected patient outcome, feel like you have failed a patient, or are second-guessing your abilities, you may be having a second victim experience. This can happen to anyone on a healthcare team, and when it does, it puts the individual at increased risk for developing burnout and depression. Second victims may be at increased risk for developing thoughts of suicide and for substance abuse problems. They are also more likely to reduce their clinical work hours or to move to a new position. Given these risks, it is important that nurses dealing with a second victim experience seek support. Reaching out to a nurse manager or another experienced nurse may be helpful. Nurses can also experience moral distress at work when they feel that what is happening to a patient is incongruent with what is in the patient's best interest. This occurs when nurses encounter difficult situations where a patient's home caregivers are not giving good enough care, they feel that unnecessary or futile care is being delivered to patients, or feel that patients are being given false hope by other members of the care team. The experience of moral distress increases the risk of burnout and compassion fatigue among nurses. Discussing these concerns with the healthcare team and nurse managers can be helpful. At times, institutional ethicists can also provide support and resources and help mitigate conflicts that exist. If you are dealing with a second victim experience or moral distress, I would encourage you to seek out the resources that may be available to you within your work unit, medical center, or practice group. I would also encourage you to explore the other sections on the resource page pertaining to second victims and moral distress. This includes links to national resources as well as select publications providing additional information on this topic, which may be helpful to you.